I'm Kent Mulgat with KelownaNow, joined by Cheryl Sidenburg from Interior Health, the Tobacco Reduction Coordinator. Welcome.
Thank you.
Our topic, vaping. This is something that is happening outside of all of our middle schools and high schools. Greater and greater numbers of kids are doing it. Are you worried about it?
I'm very concerned about it. Vaping and tobacco products, 1 in 5 youth are using these products, probably closer to 2 in 5, 1 in 5, 2 in 5.
Right. So if a parent discovers that their child, their teen, is vaping, what should be their concerns? What should be the primary concerns?
Well, there's lots of concerns. One of the main concerns, number one, is the possibility, and depending on how much they're using these devices, basically in these vapor products, there is most likely nicotine. Nicotine, as we know, is addictive for youth. Basically, the brain is not developed until the mid-20s. And it's a real concern. Nicotine is an addiction, and these products, whether it's cigarettes or vapor products, can lead to addiction.
Right. I hear some people saying, "Oh, there's no nicotine; it's just flavorings." But how do we know?
Well, that's a really good question. I think, maybe if we could talk about what the product is for a minute and then talk about what's in it. Because, there's a lot of kind of misconceptions about what is actually in these products. So when we look at these products, basically we had first generation vapor products, then they got a little bit fancier, and now the tank system designs. So these are battery operated devices that create a vapor. So when we look at the vapor, a lot of people think, oh, it's just water. Well, we know that it is not just a water-based vapor. So when we look at what we think is in there, what the evidence is now pointing to, it's the propylene glycol. Now, the propylene glycol plus all the different flavorings, there's over 8,000 flavorings. These are all unregulated devices, unregulated products. We really don't know what is in them, and that is a huge risk. And then on top of this, we're inhaling these products into our lungs, which again, on a long-term basis, we don't know all the health effects down the road.
So there's an ongoing experiment happening outside the school grounds, and the guinea pigs are teenagers.
That's one way to frame it. When we look at the tobacco industry, we know that the tobacco industry has always had target groups. The youth tend to be the replacement for those individuals, basically, who are no longer with us. The kids are the new market of the industry. So we want to, get them hooked on products so they basically have...
It's the tobacco industry. It sounded like you did for a minute.
No, the tobacco industry targets youth.
So years ago, the tobacco industry was told, no, you can't put flavorings into your tobacco products. That's too much of a lure for children.
Right.
Then along comes this vaping industry, and all bets are off, and it's all about flavorings.
It's all about flavorings, and it's basically to attract the youth. There are so many different flavors. Like in front here, you see everything from something called brain freeze, there's key lime, there's alcohol flavors, you name it, any flavor, from chocolate to bacon to strawberry. And it appeals to the kids for different reasons. They like the flavors.
And you've got kids that will do their own mixes and sell them to each other.
Yes, and this is a problem. So if we step back and just talk about kind of what's being done, I need to mention the legislation, because this is really important. So in September of 2016, the Tobacco Vapor Product Control legislation came out, September 2016. The premise behind this was to protect youth. They wanted to protect youth from being exposed to it, being able to buy it. Under the legislation, schools, private and public, are supposed to be smoke and vapor free. So before there were policies on school grounds back in 2008, smoke free policies for the secondhand smoke. But now with this legislation, it's moving to protect the youth more by saying, you cannot have tobacco and or vapor products on school grounds in the province.
Have you driven by Kelowna Secondary School lately? Clearly, they've decided to ignore that rule. I think they don't want the students going into everybody's backyard, so they've done the old sort of smoke pit model at the edge of the school property along the road. Are they breaking the law?
Technically, yes, they are breaking the law. So what we're really trying to do is work with the schools all across Interior Health that's right. Under our integrated tobacco program. And just to talk about our program, basically we have tobacco reduction coordinators, of which I'm one, but we've also teamed up to be an integrated tobacco program with the tobacco enforcement officers that again cover all of Interior Health. Under the enforcement end of things, we all work so closely with schools, and different situations, like you say, come up at schools. And it's not just unique to KSS. It's across the province, it's across the country that this is an issue, and it's going to take time.
So is the school making a mistake? I mean, in real terms, they have to decide how to manage this. Are they right to perhaps break the law on this so that at least the students are vaguely under their supervision and not going into the neighborhood, or what's the best way for them to play it?
Well, it's up to the schools. We engage with the schools and consult with the schools around situations like this. What do we do? Where do we go? Because it is happening. So it is really up to the schools individually to decide what their basically codes are and how they will handle different things that happen, whether it's alcohol or drugs or vaping. Many of the schools are really working very hard. They work with the RCMP, they work with their staff. We have come in, we've talked with the superintendents, their staff. We go in and we really want to hear what's happening so that we really basically know not what we think they're dealing with, but what they really are dealing with.
So how young are people starting to vape?
It can be very young. It can be as 12 or even, on average, I'm going to say around age 12. One of the
this one here, you showed me.
Yes.
I mean, this looks like something that your 13-year-old daughter might have in her makeup kit.
Yes. And this is the thing. Parents, care providers, teachers, adults, we'll just go with adults, they're not recognizing what is in a kid's pack bag, pencil case, or sitting around the house. Maybe they go into the bedroom and smell this lovely fruity smell. Well, maybe you need to be aware that they could be vaping because there are a lot of fruit flavors.
Yes.
The other piece of this that's quite difficult is we have parents who are very well-meaning. They don't want their kids to be smoking, so they may actually be out there buying vapor products for their kids. Bottom line is, we don't want anybody buying vapor products for kids. It, again, is against the law to provide vapor products to anybody under the age of 19. So while people may be very well-meaning and trying to get their kids away from combustible products, these may be considered as less harmful than tobacco products, but that doesn't make them harmless. There's risks involved.
Right. So is your preeminent concern about young people vaping the potential risks of that activity in and of itself, or is it the nicotine addiction that could quite often lead to smoking combustibles later and all that we know about that?
It's really all of it. I mean, the addiction piece is really number one. The risks that are involved in this is, again, we don't have the long-term evidence. These devices have been around since approximately 2003. When we look at long-term evidence across the country with different organizations, the best practice, all the evidence out there, this is still a relatively short period of time. We certainly try and stay up on the evidence so that we can say, this is what we believe is in these things now. These are our cautions. So with vapor products, a lot of people may be actually tampering with the fancier devices, using other substances within them, which is, again, a whole other story. They have been known to, the batteries overheat and explode. You look at these vapor product bottles like eyedroppers, they're not childproof. So if a child was to drink any of the substance, again, not knowing how much nicotine is actually in there or other things, they may say there's no nicotine, but we really don't know. The bottom line is we don't know. So if a young child or a pet got a hold of this, there's a lot more poisonings that have been reported. So
right.
Yeah.
One thing that comes up when you talk to parents, somebody always says, I hear about popcorn lung. I think some things are maybe coming out of left field, but is there a possibility of that sort of...
Yes, the popcorn lung, my understanding of that, it's a chemical called diacetyl, and they found that in a lot of the butter product flavorings actually in the popcorn manufacturing business, and a lot of the employees ended up with this, the small particulates in the lungs causing some issues with breathing.
Yeah, I mean, lungs are a very complicated and delicate structure. It just seems, from a layperson's point of view, that it's not such a great idea to suck a bunch of materials, oils and flavorings down into that system.
Mm-hmm. Again, we have got to stop marketing to the youth. The legislation really, truly is there to protect people.
Right.
Again, within our program, the integrated tobacco program is under the larger umbrella of healthy communities. So another piece of work that we do is actually beyond the schools. Of course, schools are out there in in communities. We actually work with local governments as well to promote smoke-free outdoor spaces. Right. And when the new legislation came in, we asked, could you please include vapor products in your spaces?
But legislation, we've sort of given up with the idea of legislation when it comes to drug use. I mean, if parents start saying, live by the law, you won't vape, well, you're just going to push it underground, won't you? And then you've got even less control. Is that not a concern?
Well, I think you have to kind of line things up. Everything always ends up being a multi-pronged approach. So legislation, it is important. It is there. The enforcement piece, we need to keep working together, whether it's schools, local governments. We all have to work together to somehow combat what is actually happening. So, here's a good example. If kind of a real situation, I won't say more details than that, but let's say you have somebody outside the school going into the school, selling to a student in the school. Then the student is reselling to other kids in the school. So that is actually something that can be tackled within our existing program with consulting and engaging with the school, working with the RCMP, seeing if we can nip that in a bud so that kids are not selling to kids. So
right, but it does sound to cut off the supply of it seems futile. It's too easy to get it. So I'm thinking, to make this useful for any parents who are watching, I think that the best advice would be to at least start a serious conversation with your child or your teen if you think they're vaping, to
absolutely
lay it out on the table what the concerns are and try to convince them to not do it as best you can.
Well, have the conversation. Start the conversation. Be aware. Notice things. Notice things that are, in the house. Notice behavior.
This isn't makeup.
Well, again, this is lip gloss and this is a vapor product. Again, do you recognize the difference if you're not looking closely? So parents, again, the schools, they message out to parents. We all try to work together on this. It's been really difficult because we just kind of, quieted the tobacco piece down, right? So people are actually smoking less. But what is happening now is the vaping is on the rise. So we're starting to see this other piece happening, and it's a difficult thing to do, but you have to stay at it. You have to keep trying. You have to have the conversations. You have to not have products like this so readily available over the internet, again, which is not regulated. The internet, social media, it is very accessible, and it's a huge issue. We want to keep this out of the hands of the kids.
Well, that's going to be a tough one. Let's have a conversation about this again in a few months. We'll see how the battle's going. All right?
Thank you.
Cheryl Sidenburg, the Tobacco Reduction Coordinator for Interior Health. Thanks for coming in.
Thank you.
This is Kent Mulgap for Kelowna Now.